So today our topic of discussion is rabies virus infection. So topics which we are covering in this video are introduction, pathogenesis, clinical features, and at last we will see vaccination. So in introduction we see rabies virus causes rapidly progressive acute infectious disease of central nervous system in humans and animals. It is transmitted from another rabid animal. In 95% of the cases, it is because of dog bite. Now, talking about pathogenesis of the infection, after bite by the infected dog to the leg of individual, the viruses multiply locally into the connective tissue and muscle at the site of inoculation. Then viruses bind to the nicotinic acetylcholine receptor present at the neuromuscular junction and enter into the peripheral neuron, then spread via neurons. Then they cause infection into the central nervous system. They are most commonly found in hippocampus and cerebellum. Then they spread via centrifugal route to various organs or tissue like salivary gland, followed by pancreas, kidney, heart, retina, and cornea. Then they are also shed in saliva. Then they cause different pathological changes into the patient because of damage to the brain neuronal cells. Now we will see clinical manifestations in rabies infection. The incubation period of the rabies infection varies from 20 to 90 days. It varies from person to person and depends on various factors. The clinical features of this infection can be divided into three phases. Number 1 is prodromal phase. This phase lasts for 2 to 10 days. During this phase, the patient suffers from fever, malaise, anorexia, nausea, vomiting, photophobia, sore throat, abnormal sensation around the wound. The second phase is acute neurologic phase. This phase is characterized by hyperexcitability, that is anxiety, agitation, hyperactivity. There is also autonomic dysfunctioning, which is characterized by there is increase in lacrimation, salivation, perspiration. There is also cardiac arrhythmias and priapism. Most common feature of this phase is hydrophobia and aerophobia. It is because of the act of swallowing precipitate involuntary painful spasm of respiratory, laryngeal and pharyngeal muscles. It occurs because of dysfunctioning of the infected brainstem neurons. This phase is also characterized by flaccid paralysis of the affected limb. The third phase is coma and death. The death of the individual occurs within 14 days. It may maximum prolongs up to the 30 days in some patients. Now we will talk about post-exposure prophylaxis. A series of rabies vaccine injections should be administered promptly after the exposure. The cell line derived non-neural vaccines are recommended. The vaccines which are available are: number 1, purified chick embryo cell vaccine, that is PCEC vaccine, purified varicocele vaccine, that is PVC vaccine, and third one is human diploid cell vaccine, that is HDC vaccine. These all are non-neural vaccines. Rabies immunoglobulins are also available which provide passive immunization to the patient. This should be given within 7 days of exposure. They are available as human form and equine form. They should be infiltrated directly into the site of wound. So this is all about rabies infection. Thank you.